Bob and Brad, the two most famous physical therapists on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
Together
therapist.
we have the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to talk about how to improve your balance and decrease your risk for falls and hip injuries.
Falls and hip injuries go together like peas and...
Peanut butter and jelly.
There you go.
How's that? As we get older, our bodies can experience a significant decline in strength.
Right.
If you do nothing as you get older, your strength is going to go down like 5% a year.
Muscle strength as well as your integrity and strength of your bones.
Right.
So it's a
right.
double-edged sword kind of a deal.
So we're going to show you 3 exercises to do. One's kind of a progression. It's one exercise, but you can progress it. But these are the ones that I see mentioned quite often when you want to try to improve strength for balance.
Right.
So
Sit to stand.
let's just start with sit to stands.
Yes, sir.
Now, if you have trouble getting up off the chair, the first thing you do is probably put a pad underneath the chair.
I've had people use a pillow, but it's got to be something firmer, the better, or a cushion of some sort.
It's amazing when I've had people that literally can't get out of their chair, and we just put like 2 inches and they pop right out.
Yeah, it's amazing how much easier, just like you say, a couple of inches will do.
So that person probably is going to need the armrest too to start off with, and that's what we're going to do. Just 2 sets of 10. Going straight up. Not straight up, I guess. We always say nose over the toes, right?
Right. Just avoid going excessively forward.
If you can.
Think about working those leg muscles, squeezing the butt together so you really get some good strength throughout those hip muscles.
All right, then you probably want to progress to no armrest.
Right. Or you could take the pad out.
Either way.
Whichever you would
Either
like
one's
to do.
a progression.
I'll take the pad out. Bob will take his hands off.
Yep. And now I might push off my thighs.
Sure.
You
Yep.
know?
Whoa, I could tell the difference without that.
Yeah, can you?
Oh, yeah.
There we go. All right. Then you want to progress to no help with the arms.
Sure.
And I probably want to get rid of the mat now, too.
Yeah, by that time, it's probably a
Boy,
good...
this is lower.
It is quite a different. I have my patients, sometimes I'll have them put their hands together like this.
Sure.
Just so they have a place to put them so they don't go down. But if you still need to do here, that's...
Yep, and then you can go arms out straight.
Yep, exactly.
And that'll be the final one. I guess you could go arms overhead if you really
Yeah,
want to make
that's a little more advanced.
That
Yep.
is more
Whoa,
advanced.
yeah.
Yep. So, all right, 2 sets of 10. Next one, hip abduction. So now with this one, you're going to get behind the chair.
Sure.
And there's a couple ways you can do this, but we'll show you multiple. We always give people options.
Good, steady chair you need.
I'm going to be this way, Brad.
Okay.
So you can see that I'm keeping my toes straight. So yeah, it's a little low for me actually. But what you're going to do is you're going to work those muscles. There's small muscles on the side of your hip. They're really important for balance and also for hip stability. So you're going to go ahead and just bring your foot out like this. Don't bring it out like this, toe straight out. You're bringing it straight forward that way. And you're going to do 10 times of that side and, of course, 10 times on this side.
And maybe from your angle, you can show them the wrong...
Don't be dipping like this.
Trunk and shoulders, head straight up, no motion there.
Keeping the body in alignment here. Brad, did you want to show another option?
Yeah. If you need more resistance.
Right.
Yep.
And more functional, I mean, if you want it like real life.
Yep.
Because you can move with this.
They have loop straps you get. We've got these wide ones actually really comfortable and they work well. Otherwise, there's those latex ones that are a little narrower and they bind up a little bit. But they work as well.
Yeah, and you can start behind the chair.
Oh.
Yeah, that adds a lot.
This is advanced, depending on your balance. But now I can really feel it. I'm going to go down. By the time I would get to 10.
Yeah, you'd be hurting.
Yeah, so this is clearly more advanced.
Now, Brad, you could even just go along, right? I mean...
Oh, you mean...
If you wanted to get advanced.
Lateral motion?
Yeah, lateral motion.
Sure. Yep. And, to start out with,
I'd use some gait aid.
So then, and this is good for strengthening and, balance.
Yeah, exactly. That's why I like it. It's adding 2 things. in one.
One thing I did not mention is it makes a significant difference if you move it. Here, I'm pulling my pants up. Ooh, I do have socks on there, shorties. It's much easier the higher you get it to your hips. And when you bring it down by your knees,
Yeah, it's really a challenge.
it's really more difficult. So that's a nice way to vary the resistance.
All right, the last one, we don't want to forget the ankles. The ankles, a lot of balance and strength come from the ankles. So we're going to do zigzags.
Oh, yeah.
So, Brad, you want me to do them?
Sure.
So,
And you may want to do this with a countertop in front of you to start out with, so you have something to hold on to for balance.
so yeah, a little bit difficult on this carpet, but it's doable. You do want some resistance. So
Right.
the
You
carpet is
probably
this
want
way.
to do them with your shoes on, because with the shoes off, it'll be too slippery,
Yeah.
and you won't get the same benefits. You have to have resistance for strengthening. This is kind of like the old,
You're thinking Charleston or something?
yeah, the Charleston, exactly. So if you have a little bit of that dance history, you'll feel right
get
in
into that
place.
away.
Yep.
Okay. All right, Brad. Those are the exercises.
Okay.
So now we're going to just talk briefly about some other things here. If you have a need for an assisted device, Brad and I run into this all the time. People say, I'm not going to use a walker or a cane or a
Yeah,
crutch.
I'm too young for that. I don't.
Yeah.
My balance is plenty good. I'm not going to be seen with that.
Yeah, but
know?
yet they will do this, Brad. They will do this. They will have hip pain, so they're walking and they go,
Yeah, that Trendelenburg
Yeah.
gait we call.
and
A lot of
that-
times they don't even know they're doing it.
Yeah, and that to me draws more attention than any cane would.
Yeah.
So, and with a cane, that would straighten out, and
Mm-hmm.
you're teaching your body to walk incorrectly when you walk like that.
And then your joints wear out.
your joints
prematurely.
wear out, and the muscles that you need are getting stretched instead of getting tight and working like they
Yeah,
should.
the mechanics just it's starting to ruin your hips and your body.
Yeah. So if you go to our channel on YouTube,
Mm-hmm.
Bob and Brad, like how to walk with a cane, it'll show you that.
Yeah.
Well, also we got an upcoming video on this video series.
Mm-hmm.
This is part of a series, by the way. It's on our website, bobandbrad.com, and go to the program section
Mm-hmm.
and look for hip pain. And we have a whole series of videos on hip pain.
Right.
And just watch the ones you need to watch. But there's going to be one called How to Walk with Hip Pain using a cane, walker, or walking stick, and so on.
Right.
But
And along with that, there's a printout PDF. You can print
Right.
it out on paper, so you can have a review of the video and showing exercises and some key points.
yeah, this is one where you're really going to want to print it out from this program, from this video, because we have a home safety checklist on there.
Yes.
And it's extensive. So it goes through every room of your house and tells you what you should be looking for. Like, like your kitchen, your stairs, your bathroom.
Very common things that therapists will use so that it's fall prevention.
Right.
Throw rugs. Do you have throw rugs? Because that's one of the number one reasons for
Either
falls.
throw the rugs away or you got to adhese them down.
Yep.
So and then you got to be careful too. But you want to make sure there's no ledges, or if there is, like I've seen people take tape on the edge of the stairs.
Yep.
So you can see the edge of the stairs
Yeah,
real well.
a lot of little tricks that are going to help prevent falls,
Yeah.
particularly for the elderly. Primarily.
Lighting is really
yeah.
is really needed too, because if a person gets up in the middle of the night and
Yeah.
they don't have the clap on, or,
Right.
there's going to be a lot of falls there. So
Those night lights, particularly down towards the ground, so you can. The visual part really helps your balance as well, as though you don't stumble into something.
Right. So we wanted to finish this one by saying, the holidays are coming up here, and we want to be careful on the holidays, because I see a lot of people, both my mom and my mother-in-law, have fallen at a holiday gathering because they're excited. There's so much activity going on.
Right.
They're getting pulled one way or the other, and
Must be some wild parties.
just a lot of people. We
Sure.
have 60-some people on my side.
Right.
So
And it may not be a physical. You're talking about just the
yeah,
attentiveness.
She
is-
stands, and so I'm always real careful with my mom. Like, I actually have her hold on to me
Yeah.
when we're doing anything. I mean, because not even let her go to the bathroom. I walk her over to the bathroom.
Right, you got little children possibly running
Yeah,
around.
yeah,
and-
and everybody's calling her. That's how
Sure.
she fell at church too. Somebody called her name and she turned around and went down. So
It was, oh, good. It was a person. It wasn't.
no. Oh, good Lord.
Well, you know.
I guess good Lord.
Yes, exactly.
So, and the other thing we want you to be aware of is sit-to-stand chairs. Now, Brad and I, they are fine to have.
So he's talking about the furniture that you
Yeah.
push a button and it lifts you up.
Right. The problem with those is you start developing weakness. You lose that ability to go from sit to stand.
Right.
So if you have trouble getting up, just put the chair up as high as you need to stand.
Yep.
Don't put it up all the way. And I mean, you want to start building up those muscles again.
Right.
So,
There may be exceptions like after a surgery
Right.
when you're weak, but don't get in a habit. Once you get stronger, start to lower it and regain the strength so you do not need that elevation.
I literally could tell when somebody would come in and I'd watch them go sit, stand, or they couldn't, and I'd check their leg muscles, and I'm like, "Do you have a stand-up chair?" And he goes, "Yeah, how'd you know?" It's like, yeah, it's very evident very quickly. So,
Yeah.
all right, Brad. Remember, we can fix just about anything
Except
a
for
broken heart.
yes, sir, and ma'am too, and we're working on it. So.